And now I'm pleased to introduce Dr. Anna Tubina. Anna is a certified functional medicine health coach, a registered health coach with the Health Coach Alliance of Canada, and a certified appreciative inquiry and change practitioner. Anna is also our subject matter expert who has been working with our team to develop course content, and we're fortunate to have Anna continue in the program as an instructor as well. Thank you, Anna, and I'll hand it over to you.
Thank you so much, Christy. Hello, everyone, and thanks for choosing to spend this hour with us. Christy, thanks again for your kind introduction. As Christy mentioned, my name is Anna Tubina. I'm a certified functional medicine health coach and a registered health coach in Canada. I currently have my own private coaching practice, and I also work with corporate clients. And it's been my pleasure for the past several months to work with School of Continuing Studies, Christy in particular, in McMaster University, and act as a subject matter expert for the program and also act as a course instructor for the number of courses in the program. With that, if you can kindly give me a moment and I'll share my screen with you, and I'll start my piece of today's presentation. So that's me. We're going to skip over this slide. If ever you see me looking sideways, please don't be alerted. I'm just handling and switching in between two screens here as I'm presenting. So my intention for today's webinar is to provide clarity around who health coaches are, what they do and what they don't do, which is also very important. I will also share with you key industry trends and some informative statistics. And at the end of my presentation, I will highlight possible career paths for those who are choosing or considering becoming a health coach. And with that, we begin. So in the heart of health and wellness coaching lies the act of helping people change their health behavior. What do I mean by health behavior? By health behavior, it's essentially an array of lifestyle habits that create a framework of how we live our lives, what we do or what we don't do regularly to maintain our well-being. Sometimes we maintain our well-being, sometimes we compromise it. And what are those habits? Good examples are what we eat and how we eat, when and how long do we sleep, how we manage our stress, in what relationships we are in with our emotions, how much physical movement do we welcome in our daily lives, etc. And I really like this definition that you see on the screen right now by the definition of the health coaches by Dr. Rangan Chatterjee. Dr. Rangan is a very famous functional medicine and integrative doctor in UK, and he's written a number of amazing books, which I highly recommend. So he says in one of his interviews, health coaches are health behaviors ninjas. And I really like that. And in the next, over the next several minutes, I really invite you to unpack what it means together with me. And we're gonna start doing this by going through an exercise. I'm gonna offer you to join me in a little explorative exercise, and for that we're gonna use Slido. I'm gonna switch to another screen, and you can also monitor the chat because you have an important information about the exercise in the chat as well. So what you see on the screen right now is the Slido screen, which describes a scenario for you. Before I'm going to go in the scenario, I'll give you a couple of technical instructions. So we're going to be creating a word cloud together with you right now. And to do that on the technical side of things, I invite you to just grab your phone and use your camera to scan the barcode that you can see at the top left corner, or if you don't have your phone or camera handy, you can just type slido.com in your browser and enter the code that you see on the screen and as well in the chat. And while you're doing this, I'm gonna be describing the situation. Actually, I'm gonna pause for a second so you can handle the technicalities. And this is the situation that I suggest you to imagine. So imagine you just visited your doctor and they notified you that in order to maintain the current level of well-being and avoid the very negative health prognosis that they can see based on your tests, you will need to change your diet, no sweets, no processed foods, lots of vegetables, lots of clean liquids, and to lose at least 15 pounds before you see them again in 6 months. So this is quite a bit of information from the doctor. The appointment is short. And my question to you is, sit back for a second, put yourself in the shoes of this person and think, what thoughts are racing in your mind? What are your feelings? And as you type in your responses, we're going to see the word cloud appears in the chat on the screen. Yes, thank you so much for those who are participating. So we can see a lot of emotional and thinking related input here, concerned, overwhelmed. Somebody says embrace, which I really love. Alone, that's an important word that I would like you to remember as well. A lot of words around being stressed, being anxious. What's the best way to do it? I really like that one. So this word cloud, and I can see it's still forming, so please going, really represents the why of the coaching profession. And it really represents the value that the coach is bringing. And you will see how I will unpack it for you in a minute. So in the interest of time, I'm going to switch back to my slides. But you will have the recording of the webinar after, and we will be able to take a print screen of the results, because I think this is amazing word cloud to keep in mind after the fact. So let's go back to the slide where we were before, and actually I'm going to take you to the next slide. So as you can see from this exercise, behavior change is a very complex process that can be very frustrating. And I like to visualize it in the form of an iceberg. The top represents the visible changes in people's health behavior. Sometimes we observe somebody and we can see that they just keep sticking to the old habits, even though those habits do not serve them well, right? Sometimes we can see, or even we observe in us as we try to change in ourselves, that, you know, we try to join gym membership. We try to eat healthier. Some days we're more successful, some days we're not, but we're in the process of trying to adopt new habits, right? And sometimes we witness a complete transformation of people's life. They just adopt completely new mindset, completely new lifestyle. They really start caring about all aspects of their well-being, right? But that's the top part. That's what we see. And then on the bottom is that's where the actual work happens, right? Underneath it, in yellow text, you can see all those factors that influence people as they embark on health behavior change journey. We're influenced by old habits. They really ingrained in our head very well. Cultural backgrounds, our past experience, family circumstances, a work-life balance, the amount of stress in our life, social circles influence, you know, what do our friends prefer to do in the evening, exercise or sit on the couch, watch TV with some fries in their hands, right? We're influenced heavily by our belief system, by values, etc. And all of that come into play when a person decides to change their behavior. Now, let's go back to that example from the exercise that we've just done together with you in Slido. And think what that person, that patient, could be doing. Where in the existing field of health and wellness, they can solicit support, and what kind of support and help that could be. So at the very top left corner, you know, we can see the expert medical advice, potentially some drug prescriptions, high-level information on what we need to do and why. A person could go to a naturopathic practitioner, a naturopathic doctor, or dietitian, or nutritionist, and they can get some more of a lifestyle prescription. They can get more specific dietary advice. They will definitely get advice from their family members and friends if they share the complexity of their situation. No, those advices can be helpful and supportive. Sometimes they would put additional pressure. Like, I told you you needed to start exercising years before. They can go and look for information online, books, blogs, mobile apps, lots of things available out there. They definitely may need some mental health support if the situation is very, very difficult and challenging emotionally and psychologically. And fitness classes, training plans, fitness club memberships are there. But what's happening here is you can see the person is alone in the center of that need for change circles. We're still frustrated. We're still not sure. We're still overwhelmed by the amount of options that we have on how to do that. And that's exactly where health coaches comes in. Their primary goal and the primary value that they bring to their clients, they come in the center of this need for change circle and stand side by side with their clients. They become the trusted allies on the journey to health behavior change. And so that brings us to more formal definition of who health coaches are and what they really do. And so you can see on the very top that coaches can be defined as behavioral change experts. They are allies on the change journey for their clients. They are biggest cheerleaders and the supporters. They are thinking partners and the strategy builders. And they are sometimes the providers of reliable information, evidence-based and science-based health-related information for their clients. Now, which brings us to the next step. What health coaches do. And you can see quite a long list here, but it's all very important. First and foremost, they need to create a safe, change-promoting environment for their clients. They help their clients to get in touch with themselves, meaning that they help raise self-awareness about what well-being means for their clients. The clients, with the help of health coaches, understand where they are right now in the current situation and what it is where they want to go. And together, a coach and a client co-create a path. Also, what's going on the other side of health coaching work is eliciting and building the motivation for change, helping a client to lean on the intrinsic motivators and build their confidence that they actually can do all those changes. And those changes can be consistent. They can become a new lifestyle. With that, sorry, I'm just going to go back for a second to the previous slide. With that, as I'm wrapping up the part of my talk about what health coaches do and who they are, I want to finish it up with one important note here. I want to draw your attention to the fact that nowhere on this list that you can see, we have a line of health coaches providing expert medical advice. We don't see health coaches offering supplement prescription anywhere here. We don't even see the mention of the building meal plans or providing dietary recommendations. And this is very important because this is not in scope of what health coaches do. Health coaches can serve as information providers, but they are not there as primary healthcare practitioners. And this is very important to understand. Health coaches work with behavior change. Which takes us to the next piece. I've got 2 more slides to go. And this slide really shows you several important numbers that represent the current state of the field of health and wellness generally. You can see that it's a huge market. And US health and wellness coaching industry in particular has been estimated at $7 billion, which is a huge number. And it was noted for multiple past years that it's the fastest growing industry generally among the industries based on the reports. Now, a couple of numbers down below in red boxes to show you that the importance of health coaching profession will be on the rise. And the reason is because the projected healthcare costs due to the chronic disease pandemic, specifically in US, they are estimated as a huge number, $47 trillion, which means people will need to have access to those practitioners and professionals who can help them embark on their own health journey, who can help them become their own doctors, essentially, by embarking and adopting a healthy habits. And also very alarming statistics and projections that we're going to have a shortage of, and we already have, both in Canada and US, a shortage of primary care providers, the primary care physicians, which is also will be having a negative impact on the population, and population will need to have different outlets, different people who they can go to in order to support their well-being. And I want to really wrap this up with a beautiful quote from Dr. Mike Hyman. He is one of the leading functional medicine doctors in US. And he says in one of his interviews that health coaches will create health in the future. And he explains why. He explains that doctors will not have time to sit with a patient long enough to understand what the patient can do for their health. And he goes on to say that the coaches will provide the instructions, they have the tools, they have the information to facilitate the behavior change. And lastly, I would like to wrap up my piece of this webinar by highlighting for you some of the exciting career paths that are open for those who decide to become a health coach. So what could I do, if I become a health coach? Some of the classic career paths right now, the top three at the three at the top that you see, you can have your own private health coaching business and practice. You can be self-employed. You can work as a hired health coach in the clinical setting, which means you will be supporting doctors and their patients, making sure that the patients are compliant with doctor lifestyle and sometimes even drugs or supplements prescriptions. And you can also go into the corporate wellness field. Some companies are hiring health coaches and many just collaborate with them. And on the point of collaboration, two emerging trends or in the health and wellness coaching is, first of all, it's almost unlimited potential for different types of collaborations for health coaches. You can get doctor referrals, even if you're not hired by the clinic. You can work on the wellness retreats. You can collaborate with healthcare organizations, spa salons, etc., yoga studios, you name it. And another area which is on the rise right now is digital health. There are a lot of mobile apps, online platforms, and virtual memberships that are being launched with the purpose of supporting people's well-being, and health coaches are more than welcome to contribute in those digital realms of our lives. So with that, I really would like to thank you for your time today, for staying with me, and just remind you that at the very end of my presentation, we have a slide with the contact information of the School of Continuing Studies of McMaster University.